Hey, what's up, Elyson? We are back today with an interview. We've got today Johnson and Clara, and we're going to be learning their story on how they got started to run today the Elyson Family Dental right here in Elyson. And so, Johnson and Clara, I know you as dentists, of course, and I'm eager to hear your story on how you got your own business running. But tell us, who is Johnson? Who is Clara? Where are you from? And how did you end up in Elyson?
Okay, well, I'm Johnson. This is my wife, Clara. I grew up in New Jersey, in the suburb. Came down to Texas back in 2004. So I've been down here for about 21 years. Been in Houston for about 11 years now. My wife and I were living in the Heights for the last 4 years before Elyson. We knew we wanted to start a family soon. We were looking at a suburb community. We searched around Houston. We came across Elyson because one of my classmates that I went to dental school with actually lived in Elyson way before us. And then we came and visited a few times. We saw the neighborhood, fell in love with it. We knew we just wanted to build a house around the area, so we started looking for some spaces for our office. That's how we started Elyson Family Dental. We've been open since 2021, right after COVID, and we've been here ever since. So we're going on our 5th year this year now.
Awesome, very awesome.
Hi, I'm Clara. I'm Johnson's wife. I'm also a dentist at Elyson Family Dental. I arrived in Houston for dental school, and then I met Johnson, and we got married, and then fast forward, we found a house, and then we found a location, and then that's how we ended up in Elyson.
Awesome. So did you guys meet each other as dentists already, or tell us, was it in school? How did you meet?
So I was a dentist already. I graduated a few years before her.
Okay.
I was still a 4th year in dental school.
Yeah, she was still a dental student when I first met her. We were traveling pretty far. I was living in Spring at the time. She was going to school in the medical center, so an hour trip each way.
Yep.
Afterwards, we just continued dating and eventually got engaged and got married. We were working at separate practices initially for the first few years of her graduation.
Okay.
And then eventually we came together. We knew we wanted to build a practice together.
Awesome.
And that was our dream, and that's how we became to Elyson Family Dental.
Cool, cool. It's a little different than most entrepreneurs, right? Because when you become a dentist, you know you're going to become a dentist way ahead of time. How much schooling does it take to become a dentist? How many years in school?
4 years of undergrad and 4 years of dental school, So 8 years,
Okay, and same for you, I assume?
Same.
Okay.
8 years.
So you knew you wanted to become a dentist. Why? What led you to become a dentist, Johnson?
For me, coming from an immigrant family, healthcare was not our priority growing up.
Okay.
I don't think I saw a dentist till I was 21 years of age.
Wow. Okay, really?
So it was just not a routine thing.
Yep.
I knew growing up, seeing that I wanted to be in healthcare. At first, it wasn't dentistry. I thought about medical, doctor, pharmacy. And throughout college, I shadowed at multiple different clinics, and dentistry was the one that I felt that had the most connection. I felt like we had the one-on-one interaction with patients. We had a little bit more control of our time.
I see.
So that really intrigued me, and that's the reason why I went to dental route.
Very interesting. So was it in some sort of internship, or?
It was just a shadowing opportunity with some dentists when I was in College Station. I went to A&M as undergrads.
All right.
I did some internships in hospitals, and I felt like the private practice setting was more accommodating for my schedule, and it was just more interactive with patients.
Yep, and hence the burgundy color. Is that what it is? Yeah. Good. Very cool. And Clara, what led you to be a dentist?
So again, I didn't really start off thinking that I was going to be a dentist, but I majored in biochemistry at UT. It's
the nemesis here.
The relationship that could have never happened.
Where's the burnt orange, right?
Right.
I don't know.
I should get one.
Okay.
Oh, now I get it. A&M burgundy.
Yeah, you didn't even get it.
When I first went to A&M, I never even visited the college.
No?
I came down to Texas as a junior in high school already. So when I was applying to school, I just went to whatever school that offered me the most scholarship.
Yeah.
First day I stepped on foot to campus, that was when I started school. So I never visited. I didn't know the rivalry between A&M and UT until years later, That's
interesting.
But,
very interesting. No, cool. So you went to UT.
I went to UT. I did get into A, and I was like, not for me.
Okay. Below you, beneath you.
And then I went to UT. I was in biochemistry.
Okay.
We do get to have some exposures to research when we're in science fields. And then my dad was also a chemical engineer, and then he was deeply in the research industry. So
Interesting.
so I had exposures growing up.
Okay.
But obviously, like staying in the laboratory doing like research that's needing to be do over many times, it was just not something that I enjoyed. I enjoyed interacting with people a lot more, and then I enjoyed like talking to people, and then like coming up with solutions like directly, and then right after like seeing them, like to be able to help them, that was more immediate pleasure for me.
Sure.
So I was starting to look for more of like healthcares, you know. That was a route of how I ended up in dentistry, because I also like doing some like hand work, like including like art stuff. So it was the combination of everything, you know.
Good.
Just had the little bit of engineering part, a little bit of interactions that I needed in order for me to feel like I'm still, you know, enjoying my day-to-day activities, and then also the art that, you know, incorporates into it. Yeah.
So you liked the customer-facing side of the business with dentistry. Interesting. So did you start your undergrad already planning to be a dentist, or was that something you discovered along the way?
I discovered it about like second and third year into my college. Yeah.
Interesting. And did you know anyone that was a dentist, or?
I did not. Yeah, I did not. Yeah.
Same.
Good for you.
First generation, no
Fell
dentistry
into
background.
it, started it out.
Yes.
Okay.
Yeah.
And so, at what point did you realize, okay, I'm going to be a dentist, but not only be a dentist, but I'm going to have my own practice? When was that? How did you get to that point?
I think once I decided to be a dentist, being a practice owner was always a goal. That's one of the most intriguing thing about dentistry, is that private practice was an option, unlike medical doctors who are usually located in a hospital setting.
Okay.
But the time when I really knew I wanted to own a practice was after I met my wife. I felt like with the two of us combined together, we had enough knowledge and expertise to open a practice, because opening a practice is not only about being a dentist. That's probably the minority side of it.
Yeah.
Managing practice, learning about staff, managing staff and patients, that's the majority of opening a practice.
Yeah.
So dentistry itself is the easy part.
Sure.
But after we met, that's when we really decided that owning a practice was the right route for us.
Great. And what about for you, Clara? Was it all on the same timeline by that point, or?
I think I figured out early on,
Yeah.
because we get to work with our clinical faculties in school, and then they had taught us, like, you know, it's a whole new world outside of the school.
Yeah.
You know, they prepare you to do clinical stuff, but there's a lot more that engages with like owning a practice, and then it sounded a lot more intriguing for me.
Yeah.
So I mean, we needed to have some kind of experience in order for us to be ready.
Correct.
So I chose to like work in different settings of different offices prior to, so that I can have an exposure of like, one, like what kind of insurances are we taking, one, like what kind of management styles are we doing, are we doing multi-doctor office, are we doing single doctor office, those kind of things. Like I had to have some kind of exposure to understand what I really wanted to build in the future. So that was like a good, you know, stepping stone for me. Yeah.
Interesting.
I think COVID really kind of pushed us, because it gave us a few months of we weren't working. That really kind of gave us time to plan the office, design the office, going out there looking for contractors and things like that. Before that, we were working full time, nonstop. We didn't have the time to build the office. So COVID was a blessing in disguise. You know.
To really focus on what you want.
Interesting. Very interesting. So it was a pivotal time. I want to jump to the school too before we move on from that. You mentioned that dentistry is a business, right? You have people to manage, books to balance, all this kind of stuff. Did you get anything from that in school, or is it strictly focused on the science and the healthcare? How does that work?
Out of my 8 years education, we got a 1 hour course.
1 hour
throughout
course.
the 8 year of a business class.
And that made you master.
That was it. They expected us to come out and be masters.
And then from there, you knew exactly how to open your own business and run everything perfectly.
But we're still learning as business owners.
Sure.
Ongoing. You know, especially as a small business owners. You know, to learn the quality that we can provide for our patients and also our staff, you know, the working environment that we can provide. So it's an ongoing process.
Got it. Now, rewind us to COVID. 2020 comes, the world shuts down. Anything with a mouth is taboo. I'm assuming you take emergencies. Is that fair?
Right.
I'm sure that also was a nervous time for you guys.
Yes. We had no income.
No income. And so were you working for a practice at the time? Different practices?
Yes,
Is that
different
fair?
practices.
Okay. And then were you starting to plan then
Yes.
for a practice together, or what did that look like?
So I think that's the time that when we were looking for locations, and we had already received like a floor plan, and that's when we started really working towards like, okay, like how many chairs are we able to fit?
Okay.
You know, how are we fitting our office versus where the front desk is, and that kind of designing part actually started then. Yeah.
So do you Google that, or how do you find that kind of information? What's the normal thing to do?
We asked around a lot of we have a lot of
friends.
colleagues. We got some information through that route, and it was just some of it was Googling, you know, learning as we were going.
Okay.
You know, going from contractors' suggestions and realtors' suggestions. But during COVID time, we were working at separate practices, but we were really nervous. You know, we didn't know what was going to happen after 2020. We didn't know if everything was going to open back up, but we already signed all the lease, signed all the contract. We had to move forward with it. The plan was for her to be at Elyson Dental full time, for me to still have another job full time and supplement that income if we needed to.
Good.
Then that's how it went on.
Good, very good. And then, so real estate, was that the kind of the first piece of the plan?
Very first,
Okay,
yes.
so was it where, or just more of the layouts and designs and what you're looking for so that you could find the where? How did that go? Chicken and egg, maybe?
So more like the location.
Okay.
Like, so we have to look for the location first and see if there's even any vacancy for any of the business like us to be in already. So most of the real estate, like commercial real estate that already has a dentist in there, even if a specialist, they usually have a non-compete of certain dental professions. So that also kind of like doesn't give us a lot of like, you know, options out there. So we had to be either the first one as a general practitioner. If we were to go in there, we also have a say in like, okay, we don't want certain professions in the same building. So that narrowing it down, like it became
location was key. I mean, when we found the Elyson spot, it was still grass. Only the Time-Wise gas station was there. We just had a number. We called. We didn't even know the layout of the building yet.
Right. We didn't even have anything.
Once we reached out, then they sent us, hey, how much square feet do you want?
Right.
They were dividing things up between us, nail shop, vet. I think it was us, Marco's Pizza, and the vet was the first three to go in there. So they were asking us which direction do we want to go? Do we want an end cap? How big of a space we want? And that's how they were dividing up the building for us.
Okay, very good. So from the real estate then, you had that plan, you knew that was coming. What was your next steps really in terms of building the plan to get it day one open running?
Yeah, once we found the spot, first thing was getting a contractor, getting vendors for dental supplies. I think those were all still pretty straightforward, and the dental field's pretty small. So finding a contractor and the dental supply was not hard, but finding the right team after we opened. We've never managed staff before. We've always worked at offices where the staff was already intact, things were already there.
Everything was so easy.
So the designing part to her was easy, but once we finished the designing part at the end, when we were trying to hire staff, trying to get patients on the schedule before we open, starting the marketing part on our own, that was probably the most challenging part.
And then did you have already an open date when you're doing that process of
we did,
hiring
and
staff?
we pushed back about a couple of times, just like any sort of contracting business. They promised us 3 to 4 months. It becomes 5 to 6 months. 6 months becomes 8 months. So we had some projection dates of opening. But luckily we had a list of patients that were interested. We would call them, give them a heads up what's going on with the process, just waiting for permits and stuff like that. But we did get a few dates pushed back.
Okay, interesting. So you bring up so many things here I'm thinking of, right? The challenges of balancing, hey, I need to get a team together ready to go, then need to keep them on board because we're delayed. And then I need to keep patients that I'm trying to market in and bring in, new location, and all this at the same time. And you're running all the show.
Exactly.
And we need to make sure all our equipments are working in proper way.
You hit the mark. That's exactly what was going through our head the whole time. We had to start paying our staff already because they already committed to the time with us.
You have to keep them.
Exactly. We started paying the bills already, even though the door wasn't open. We had to make sure a patient wasn't going to another practice already because they were trying to get in already to see a doctor. So it was just a lot of things to juggle. So the first year, I would say, was the most challenging year for us, and we learned a lot throughout that year.
I bet. I can't imagine. And you bring up a point too, which is the money, right? 8 years of school for both of you, right? And then the upfront capital to build out the location. It's all customized things. I imagine there's not a lot of contractors that are out there.
Yeah, there's probably like 4 or 5 that does all the dental offices in Houston.
Okay.
Dentist.
Yep. Very specialized, right? Have to meet all the codes and standards and things, I'm sure.
Yes.
And then you have the logistics of the staff and, bringing them and keeping them on board.
Yes.
And then it's marketing.
Yeah.
Okay.
Yeah.
Very challenging. So let's talk about the staff. The staff then, in terms of going out and finding the staff, did you have any lessons learned? You mentioned neither of you really had a business background.
Right.
You had some experience working in dental offices, but what kind of lessons did you learn with getting staffed up and running there?
I think from what we've learned so far is that we were looking for staff that had dental experiences. And I think looking back, we were looking more for personality nowadays because it's easier to train people the way we want.
Okay.
I want our staff to treat patients the right way. And sometimes when people have experiences, they come with kind of their own
way of doing things.
Yeah.
Yeah, I see. So almost like the experience didn't help because it was like, hey, well, my old doctor did it this way, so your way is wrong, and I'm experienced.
Yeah.
Is that kind of how it is? Or
It's a mixture. Sometimes with experience, there's good and bad things. The same thing with lack of experience. But I think if we had to choose, I would choose personality over experience.
Personality.
Yeah, because experience, as you do anything, you get more of it.
You learn.
Yeah, personality is a little bit harder to train.
That's interesting. Good take. Good take. Okay, cool. So now you got staff, you're paying them, things are being built out, you got to get supplies too, right? And work with the vendors there.
Right.
Did you have that shipped to your house, or how did that happen? You got delayed a few months.
Right. So I remember we started buying things, even like on the Black Friday year before that.
Oh, yeah. Okay. We had 12 monitor stores in our tiny apartment, the Heights. We
had 1-bedroom apartment back then, and we had like 6 TVs and 12 monitors. They were all sitting in our apartment.
All the big dental equipment was in warehouses, suppliers, but all the small stuff, like, you think about dental equipment, but in our office we have TVs, we have computers. Mouses, chairs. We were assembling chairs already in our houses, in our apartment. So we were storing a lot of those in our apartment, in our car sometimes.
It's true then, any business starts from the garage,
Really?
including dentistry. Just no dentistry practice in the garage.
Yes, I wasn't seeing patients in the garage, but I was definitely making chairs and stuff already.
Wow, that's amazing. So let's talk about getting customers, right? Because you built the location, that's great, but nobody knows you're here. Like, how do you start a dentistry practice when you have no base?
Yeah. So we first started, we just did some mailers in the beginning. First couple months before we opened, the idea was to at least start marketing 2-3 months before we open our practice, just to get our name out there, because most likely, like you said, patients never heard of us. They might want to do some research. They might want to talk to us on the phone. So initially was a lot of marketing mailers. We did some online marketings. We didn't know if it worked or not. Same thing, first time experience. We had some patients start calling. We already set up a line for our office before it opened, so we were picking up phone calls way before the office was open. We were getting information down, letting them know about our opening date, and we would call them, give them updates and stuff like that. So I think before we even opened our practice, we had about maybe 40-50 patients on file.
Really?
So that set us up for the first couple weeks for patients to come in.
That's great. That's great. So you already had a few patients to get rolling, and mailing was the main source of advertising. Did you have any other kind of forms of marketing?
Being in network with insurances that also allow patients to search for dentists around the neighborhood. They can always search based off on their zip code and the locations. So that probably also allowed patients to look for us.
Made a big difference.
And then we were in the Elyson, the magazine that also helped from day one. Just some ground marketing.
Repeat touches, basically. Hey, I'm here. Hey, I'm here. Hey, I'm here. Elyson Family Dental, right?
In our field, they say that with mailers, usually takes about 5 mailers for a patient to even think about calling a practice. You have to see something 4 or 5 times, especially in the mail, because most of the time we get a lot of spam and junk mails, and we get it too. We all do the same thing. So typically, they say it takes about 4 or 5 rounds before maybe you get 1 phone call.
It's a lot of repeat, right? And building the trust brand, and they're there. Now they're known, right? So good, very good. So you brought up a good point, insurance, right? What was your plan initially? Get in with just a few key providers? Did you have to go for all of them? Or because that's complicated too, I would imagine. I imagine it's not easy, or everyone would do it with everyone, right? How did that work?
So we decided to be enrolled with a network for all the insurances that are out there, because right now we're trying to build our practice.
Yep.
We just want to make sure that we are able to provide all the exposures, and then be able to actually do the care we would need it, just so that we can go ahead and have the patients also coming to the door too.
Yeah.
So that was the start of the process, but
We just felt like if we were patients, what would we look for?
Yeah.
I would look for a network provider. We want to be able to be in network with insurance and also provide the quality care as best as possible. But that's the decision of why we wanted to go in network, because I feel like we would do the same if we were patients.
Sure, sure. That's interesting. So I imagine that's a lot of paperwork to file.
Yes.
And a lot of back and forth in terms of managing maybe disputes and other things. Every now and then I see something on my end, there's like a dispute of some sort, right? Like, but how does that work on your side of things? What's the world of insurance like for a dentist?
That's probably what we spend half our time battling.
Half your time, really?
I have 2 dedicated staff that's solely working on insurances, either getting things verified, appealing for things. What patients don't understand is a lot of time we don't work for insurance companies. They will find any way to try not to pay us, same thing as they don't want to,
I see.
So we're spending a lot of time on the phone just to get somebody to talk to us, explaining things to us. And a lot of time the people who work on the other end of the phone, they don't do anything dentistry related. They just know how to deny and approve things, right?
I see.
So we spend a lot of time dealing with insurances.
Wow.
I would say definitely about half of our time.
Really? That's so. Even though 98.9% of your schooling was
all dentistry.
dentistry, 50% of your time is actually business practice, billing, and insurance, and other things like that. Right. So we show up, we show our fancy little card, give it to you, say work on my teeth. But in the back, you're actually sweating and working on paperwork and other things, right?
Trying to verify things, trying to make sure we give an accurate quote, accurate estimate. Even though we tell every patient this is this estimate that the insurance gives us, sometimes we'll get things pre-authorized, meaning that we tell insurance, hey, we're going to do this procedure. Will you cover this? They will come back and say, yes, we will cover this. And after the procedure is done, they'll find a way to deny it, even though they already approved it. And that's the things that we have to work with. Like, hey, you guys approved us. We've talked to somebody. We have to show paperwork.
Paper trail and all of that.
Yeah.
Okay, that's interesting. I'm sure it takes quite a bit of work.
Right.
So I'm sure that working with insurance and everything is very challenging, right? I see something quite common with dentists, right? Where maybe they start their own practice, they build it up, and then one day corporate takes over. I call the number, it's like a 1-800 number now, and it's a little bit of a different feel. They buy out. Do you have some sort of strategy? I'm sure there's definitely a return in building a business that way, but what's your strategy with family, here in Elyson, right? Elyson Family Dental. What does that look like for you?
For us, I mean, our goal, we're planning on staying the long haul. We came, got our house. We have 2 kids now, 3 years old and 1 year old. We plan on for them to grow up in the community, go to McElwain, go to high school here. So we have no plan of selling, but yeah, in the long run, we're hoping that we can maybe expand the practice a little bit to accommodate more patients if possible. But yeah, that's our take.
Awesome, great. Now it's cool to hear your story. I do want to bring Elyson by your office just so you can talk a little bit about what you do.
Sure.
Should we go take a tour of the office?
Sure.
Sounds
All right,
good.
let's go.
All right.
Welcome to Elyson Family Dental.
Thanks so much again for having us, guys. It's awesome to be here. Tell us, what kind of care can Elyson residents receive here?
Okay. So our idea when we built this practice is we want this to be a one-stop shop. We want this to be as convenient as possible for all of our patients. So in Elyson Family Dental, me, Dr. Cheng, I do most of the surgical procedures here, from extractions to root canals to simple fillings. My wife does all the cosmetic work, the orthodontic treatments, and pediatric treatments. Occasionally, we do refer some cases out, but most of the stuff we keep in-house.
Great.
Yes, we do. So for me, I'm Dr. Yoo. I mostly do a lot of kids treatments, also cosmetic works, braces, and also Botox.
Botox?
Yes.
Botox for teeth?
No, Botox for your TMJ. When you're clincher, we can go ahead and place some Botox in your masseters, and then you can actually reduce the amount of clinching you can do for your teeth.
I had no idea. I was like, do you take wrinkles out of teeth, or how does that work? So is clenchers is just people who struggle with what, grinding their teeth and
Yes,
things like
sir.
that? Interesting. So Botox helps with that.
Definitely.
Okay, interesting. Lots of things you offer here. That's great. Can we take a look maybe at some of the cool tools that you use here? I know you got-
But yeah, let's walk through and take a look at everything.
Cool. So tell us, what does this machine do?
So this is called the iTero machine. It's an Invisalign scanner. When a patient come in and they're interested in Invisalign or braces or even some just general consult, we would take the scanner. It's a wand right here. It comes with about 20 cameras on this wand, and we scan your teeth, and then we store a digital model. What the scanner also does is it can show you a before and after of if you got the Invisalign treatment. So it gives you an idea of like, is this kind of the smile that you're trying to achieve?
Yep.
So this is what the scanner does.
That's interesting. So tell us, like, why would I choose Invisalign and why would I choose braces?
So Invisalign is really good for adults who don't want to wear traditional braces for everyday work and things like that. It's a little bit more comfortable because we get to take it on and off for Invisalign. We can floss, brush our teeth a little better compared to traditional braces. As you can see, I have traditional braces. It's very hard to clean around it, especially with teenagers. Sometimes they don't do a good job. A lot of kids get cavities after braces because of that.
Interesting. So the Invisalign's kind of the way to go there.
Yes.
All right, so great. This machine here, it's pretty big. What all does it do?
So this is our Ceph CBCT machine. What this does is it takes a cone beam image, a 3D image, compared to traditional 2D images that we see in most dental offices. A lot of time when you go to a dental office, when you see the x-rays on TV, those are usually two-dimensional images. This is a 360 view of our entire jaw. If you have some sort of abscess or some sort of fracture, it's captured on this 3D machine. This little side arm right here, it's called our Ceph machine. It's a cephalometric image for our orthodontic patients. It also helps measure the measurements that we need to do braces or Invisalign.
Got it. Great, great. And then, of course, you got tanks in here. What are these for?
This is for our patients who have anxiety coming to the dental office, which is a lot of patients. It's our laughing gas machine. It helps just kind of reduce a little bit of the anxiety for patients for dental works.
Very good. Awesome. So come be happy while you have your teeth worked on.
Yes.
That's it.
Yeah.
Cool. Very cool.
So this is one of the operatories that will have the patients come. When they're here, we start off with taking x-rays with our handheld x-ray machine. So it's not something that's really hard to do anymore. It has like a really low radiations since we are not using those the old films anymore that needs to be developed every time.
There's usually a big arm, right, that comes over, none of that, just gone. All right. Good.
And then we also take intraoral camera pictures. So this is a little camera that we take pictures of individual teeth when patients come in for the first time. And this will also allow patients to understand what kind of treatments they absolutely need, and then why we need to, give certain procedures as like part of their treatments, because of what they can see is a little bit more better for the patients to understand.
Okay, interesting. And I'm seeing too, you got a screen here.
Yes.
You've got a screen up there and a screen behind you here. That's pretty cool. I'm guessing anywhere the patient can.
Right. They can. Right. Sorry. They can also be laying down and then be looking at the screen on the top, and then they can also sit up and still be looking at the TV on the front.
Got it. Got it. And are you mainly showing them what you're doing, your work, or entertainment for kids, or how does that all play out?
Right. Sometimes we have some requests from the patients if they have already been following some Netflix shows that we put it on.
Okay.
For kids, they love like YouTube shows, so if they have an okay from their parents, we put it on for that.
Great. It's a way to keep them busy, right, while you work on their teeth. That's good.
Of course.
Well, thanks guys so much for having us out here, showing us a little bit about your office, your practice, telling us your story on how you got started. Tell us though, where are you located? And if somebody wants to get in touch with you or learn more about you, where do they find you?
Okay. So we're located, our address is 23015 FM 529, Suite 400. We're in the plaza that are attached to the Timewise gas station, next to the nail shop, and next to the Snowflake Donut shop. Our phone number is 832-968-7772. If you'd like to get to know more about us, you can go on ElysonFamilyDental.com to read more about me, my wife, and about our practice.
Awesome. Thanks again so much for the interview. It was great getting to know your story.
Thank you so much for having us.
Thank you.